TB CHAMP is the first trial in the world to look at the prevention of drug-resistant TB in children. To date, there's been no evidence globally, which means that the World Health Organization could not make a specific recommendation about the prevention of drug-resistant TB in children or in adults, which means that on the ground, children at risk of getting drug-resistant TB are not getting any preventive therapy. The treatment of MDR-TB is still quite complex, very burdensome and very expensive, so prevention is the way to go. So TB CHAMP is a large South African-led and implemented cluster randomized trial, and it looks specifically at children at high risk of developing MDR-TB in households living with someone with MDR-TB.
TB CHAMP has been a wonderful study to be part of. The idea is to compare levofloxacin, which is an antibiotic that's used to treat children with TB, with placebo, and to see if the levofloxacin taken by these young kids for 6 months is actually effective and safe to prevent TB in these children. We needed to find the adults who had MDR-TB disease or drug-resistant TB disease, and then visit and screen the households to find young children who were living with these adults who would be at risk of TB. Young children in particular, because of their immature immune systems and the fact that they live very closely with their caregivers, are at high risk of developing TB and developing severe forms of TB.
In die geval soos by ons huis, kyk my broer het nou TB en hy wil nie gaan vir sy medikasie nie. So ek dink is iets goed as die pil moet werk vir die kinders se sake. You won't make it easy for me. You don't let me so scale and you can't take your tablet now, you just take it and you swallow it out water. You don't make it hard for me.
The fact that we have recruited 922 young children onto this trial is really, I think, an amazing achievement in the 5 years that it took, and it will be the biggest trial in the world that is looking specifically at prevention for children.
This trial, finally, after having funding from the British MRC, the South African MRC, and finally UnitAid, has now finally completed enrollment in August as of this year, after many challenges, and we'll see the last child on study in February. And then we're preparing to get the data ready to help inform the evidence synthesis so that the World Health Organization can update their guidelines on MDR-TB prevention in children.